Have you ever wondered what IUI is and how it can help with infertility? Intrauterine insemination, or IUI, is a tried and tested technique that aids couples on their journey to parenthood. Often referred to as artificial insemination, it's a medical procedure that aims to increase the chance of conception. How, you ask? Well, it's all about delivering a concentrated amount of healthy sperm directly into the woman's uterus. By doing so, we significantly boost the number of sperm cells that can reach the fallopian tubes, where the magic of fertilization usually takes place. But why might someone need IUI? The reasons vary, and it's often recommended when there's a mystery surrounding infertility, when no specific cause can be found. It could also be the go-to solution when there are mild sperm abnormalities, such as low sperm count or issues with sperm motility. Sometimes the cervix might be the obstacle, preventing sperm from reaching the uterus. In these cases, IUI can come to the rescue. Donor sperm? IUI can handle that too. It's also a viable option for couples who find sexual intercourse challenging, or for women dealing with irregular ovulation, hormonal disorders, or the absence of ovulation. And let's not forget those instances where the quality of cervical mucus hinders sperm transport. Before embarking on the IUI journey, there are several prerequisites to consider. These include a comprehensive fertility evaluation, possible ovulation induction, sperm preparation, and careful timing to coincide with the release of the egg. However, it's important to remember that IUI isn't for everyone. It might not be the best approach for women with blocked or severely damaged fallopian tubes, or for men with extremely low sperm count or poor sperm quality. Other contraindications include severe endometriosis, active pelvic infections, and severe uterine abnormalities. Now that we understand what IUI is, let's delve deeper into who might benefit from this procedure. Scene script. Who exactly can benefit from IUI? Let's explore. Intrauterine insemination, commonly known as IUI, can be a beacon of hope for many who dream of starting a family. It's a procedure that can help to overcome a variety of fertility-related concerns. Unexplained infertility may seem like a mystery, but it's a reality for many couples. When doctors can't pinpoint a specific cause for infertility, IUI can step in as a possible solution, giving those tiny swimmers a better chance of reaching their destination. In cases of male factor infertility, IUI can be the answer. If there are mild abnormalities with the sperm, such as a low count or mobility issues, IUI can help by delivering the sperm directly to where it needs to go, bypassing any potential obstacles. Then, there's cervical factor infertility. Sometimes the cervix can act like a roadblock, preventing sperm from reaching the uterus. By placing the sperm directly into the uterus, IUI can sidestep this problem. IUI is also an option when donor sperm is used for conception. It ensures that the donated sperm is delivered right where it's needed, increasing the chances of a successful pregnancy. For couples who find sexual intercourse challenging due to issues such as erectile dysfunction or vaginismus, IUI can provide an alternative pathway to conception. Women with ovulatory disorders, hormonal imbalances, or anovulation can also benefit from IUI. The procedure can be timed to coincide with the release of a mature egg, thus optimizing the chances of fertilization. Lastly, if the quality of the cervical mucus is hindering sperm transport, IUI can come to the rescue. By placing the sperm directly into the uterus, it bypasses the need for the sperm to navigate through the potentially hostile cervical mucus. In essence, IUI can be a game changer for many individuals and couples facing a range of fertility issues. It's a procedure that brings hope, offering a helping hand to the miracle of life. Understanding who might need IUI is crucial, but it's also important to know what prerequisites exist before undergoing the procedure. Before embarking on the IUI journey, what prerequisites should be met? It's a critical question to consider, as the success of intrauterine insemination hinges on several key factors. Firstly, a comprehensive fertility evaluation is non-negotiable. This involves an in-depth consultation with a fertility specialist who will explore the potential causes of infertility. It's like solving a puzzle. We need to understand all the pieces before we can see the bigger picture. This evaluation often includes various diagnostic tests, such as blood tests and ultrasounds, to gauge the health of the reproductive system. Secondly, ovulation induction may be part of the process. This is particularly relevant for women who struggle with irregular ovulation or hormonal disorders. In such cases, medications may be used to stimulate the ovaries to release an egg, thereby improving the chances of successful fertilization. Thirdly, sperm preparation is a crucial part of the IUI process. This isn't as simple as it sounds. The sperm must be washed and processed in a laboratory to select the healthiest and most mobile candidates for the procedure. This concentration of high-quality sperm can significantly increase the likelihood of successful fertilization. Lastly, timing is everything. IUI is often performed around the time of ovulation to coincide with the release of the egg. This optimizes the chances of the egg meeting the sperm at the right time, creating the perfect conditions for conception. But it's important to note that while IUI can be a great solution for many, it's not a one-size-fits-all treatment. Each fertility journey is unique, and what works for one person may not work for another. Therefore, a personalized approach is essential. In summary, the prerequisites for IUI include a detailed fertility evaluation, potential ovulation induction, meticulous sperm preparation, and precise timing. These elements work together to offer the best chance of a successful pregnancy. While IUI can be a great solution for many, there are certain situations where it may not be recommended. So let's delve into these scenarios next. There are circumstances where IUI may not be the best course of action. What are they? Intrauterine insemination, or IUI, is an effective fertility treatment for many. But like any medical procedure, it's not suitable for everyone. There are certain conditions and situations that may make IUI less effective or even contraindicated. One such circumstance is tubal blockage. In order for IUI to be successful, the woman's fallopian tubes must be clear and healthy, allowing the egg and sperm to meet. If the tubes are blocked or severely damaged, it can prevent this essential meeting, rendering IUI ineffective. Similarly, severe male infertility can also be a contraindication for IUI. If the male partner has an extremely low sperm count or very poor sperm quality, IUI may not be the best course of action. In such cases, other fertility treatments such as in vitro fertilization or IVF might be more effective. Severe endometriosis is another factor that can limit the effectiveness of IUI. Endometriosis is a condition where the tissue that normally lines the inside of the uterus grows outside the uterus. When it's severe, it can significantly impact fertility, making IUI less likely to result in a successful pregnancy. Active pelvic infections pose another challenge. These infections can increase the risk of complications associated with IUI. Therefore, any active infection should be treated and resolved before proceeding with IUI. Lastly, severe uterine abnormalities can also be a contraindication for IUI. If the structure of the uterus is significantly abnormal, it can make it more difficult for the fertilized egg to implant and develop, reducing the chances of a successful IUI. In conclusion, while IUI is a powerful tool in combating infertility, it's not a one-size-fits-all solution. It's critical to understand that IUI may not be suitable in certain situations, and other fertility treatments may be more effective. Understanding its benefits and limitations is key to making an informed decision. So what have we learned about IUI and its role in treating infertility? Intrauterine insemination, or IUI, is a fertility treatment that has been instrumental in helping many couples conceive. It's a relatively simple procedure, but it carries great potential. By placing specially prepared sperm directly into the uterus, IUI boosts the chances of these swimmers reaching the fallopian tubes, where the magic of fertilization happens. We delved into the various indications for IUI, covering a wide range of fertility concerns. From unexplained infertility to issues with sperm count and motility, cervical factor infertility, and even sexual dysfunction, IUI has the potential to provide a solution. It also comes into play when donor sperm is used or when ovulatory disorders or cervical mucus problems are present. Before embarking on the IUI journey, certain prerequisites need to be met. A thorough fertility evaluation is the starting point, followed by possible ovulation induction, sperm preparation, and careful timing to coincide with the woman's ovulation. However, IUI isn't a one-size-fits-all solution. There are contraindications to consider. If the woman has blocked or severely damaged fallopian tubes, severe male infertility, significant endometriosis, active pelvic infections, or severe uterine abnormalities, IUI may not be the best option. Remember, the journey to parenthood is unique for each individual and couple. What works for one may not work for another. It's crucial to have open, honest conversations with your healthcare provider to understand your fertility situation and explore the best treatment options for you. In summary, IUI has proven to be a valuable tool in the world of fertility treatments. It's a procedure that, while straightforward, can make a significant difference for couples struggling to conceive. IUI can be a beacon of hope for many struggling with infertility. Armed with this knowledge, you're now better equipped to discuss this option with your healthcare provider.